everyone, to our NCAA Social Series. This is episode number 64. I'm Andy Katz. Pleased to be joined this week by Dr. Brian Hainline, the NCAA Chief Medical Officer, as well as Dr. Carlos Del Rio, who is a professor of medicine at Emory University in the Atlanta, Georgia area. Also, this past July 4th, he was one of 34 people, just 34, who received the prestigious honor from the Carnegie Corporation as an immigrant who has contributed mightily to this country and certainly to his field of medicine. And Dr. Carlos Del Rio, I want to start with you on the Delta variant. Let's first get out the definition, because we're hearing this a lot right now about obviously how pervasive it is, how transmissible it is. And we want to just sort of take that to the college space here in athletics as we get ready for fall camp that will start for a number of sports here in August. Let's first start with what it is. What is the Delta variant?
Well, thank you, Andy. As COVID continues to transmit and continues to evolve, not only in the U.S., but globally, these viruses, as they're transmitted, they're continuously mutating. And as they mutate, they sometimes produce strains of the virus that are more likely to infect other people, more likely to evade the impact of neutralizing antibodies, such as the antibodies induced by vaccines. And this evolution of the virus over time eventually leads to these variants. And a lot of these variants have received their name. There are different ways of calling them, and many of them have been named by the country where they first were identified. The Delta variant that we're talking about was first identified in India, so many people call it the Indian variant. But a few weeks ago, the WHO decided that in order to avoid stigmatizing, they will just call the variants by giving them a Greek letter name. So the Alpha variant is a variant that was identified in the UK. Then there's the Beta variant that was identified in South Africa, the Gamma Delta variant that was identified in Brazil, and now the Delta variant identified in India. This all have different mutations, and the Delta variant, what it does is it's highly transmissible. And if you think about it this way, the original variant that we had, just a little bit about a year ago, one infected person infected about 2.5 to 3 other individuals. So what we call the reproductive number was 2.5 to 3. The Alpha variant, the UK variant, that number went up to about 5. With the Delta variant, that number goes to about 8 or 9. So one infected person is capable to infect another 8 or 9 individuals. And by doing so, therefore, spreads very rapidly, because you think about this in terms of just exponential growth. 1 infects 9, 9 infect another 9, and before you know it, there's thousands of people infected. This is what happened in India. You had a huge outbreak very, very quickly. Now, the one thing to mention, and we can talk about more later, while the vaccines have a decreased activity, they still have pretty good activity against the Delta variant. So the bottom line for everybody is, if you're worried about the Delta variant, and if you haven't been vaccinated, you should be worried. You need to get vaccinated as soon as possible.
Yeah, that's clear. And I want to get to vaccinations here shortly. But what has made this variant certainly raise more of a red flag than the previous 3 that you mentioned? Those, as you said, initially we were referring them as originating in the UK, Brazil, and South Africa.
As I said, it's simply the higher transmissibility. I mean, it burns through a naive population very, very quickly. Just to give you an idea of the numbers, if the original strain, with an R naught of about 2.5, one infected person at the end of 10 cycles has infected about 9,000 individuals, assuming that they're all naive, they're not vaccinated, et cetera. The UK variant, that would infect, one person infected would lead to about, after the end 10 cycles of transmission, would lead to about 42,000 people infected. Well, this one, doing the math, you get over 100,000 people infected. So again, it is just simply how transmissible it is. The exponential growth makes this very, very dangerous, because if you haven't been immunized, anybody who hasn't been immunized is likely going to get infected with the Delta variant.
So to that point, and Dr. Hainline, I want to get to you in a moment when we get to the college space, but I just want to get this sort of as our groundwork, sort of laying the groundwork here. How much more deadly is the Delta variant than the previous 3?
Well, there's a lot of discussion about that. Some people say it's not more deadly, but you are going to see more people sick and in the hospital and dead because simply the numbers are higher, right? If you have a disease like COVID, well, let's say the mortality is 1 to 2%. Well, if you have 1,000 people infected, 1 to 2% mortality, equals about 10 to 20 people that die. But if you have 100,000 people infected, that's just a lot more sick people and a lot more dead people simply because of the numbers. So even if it wasn't more deadly, because it infects more people, you're going to see more cases, more people hospitalized, and more deaths. There's some data from Scotland that it is more deadly and more severe, particularly in people that are older, particularly in people that have comorbidities such as obesity, diabetes, hypertension, et cetera.
So, Dr. Hainline, look, we can just hammer people over the head. It's pretty clear that people should be vaccinated. We know that. And so that is a given. And we can keep screaming it from the rooftops, and some people just aren't going to do it. So now we got to shift to what life would be like, vaccinated versus unvaccinated. And we are clearly seeing, and I will tell you this, I've experienced it at the NBA Draft Combine. Those that were vaccinated could interview players face to face. First time I was doing that in 16 months. Secondly, you could actually not wear your mask with other vaccinated people, players I'm talking about, coaches, GMs. But there were signs from the NBA that said clearly, if you were unvaccinated, you couldn't do any of that. You had to create huge distance. You had to mask. And basically, you couldn't do your job, at least on my side of the aisle, if you will. And so what would life be like, vaccinated versus unvaccinated, as we get into fall prep in August?
Well, it's a good question, Andy, and we already have tiptoed into that. We put out a summary socialization document, and we clearly differentiated in that document between the vaccinated and unvaccinated. And essentially, we said for those that are fully vaccinated, that they would be living life in many ways similar to pre-pandemic. I mean, we're all taking hopefully enhanced standard precautions, but they're given much more liberty than the unvaccinated, where we're saying, look, we still want you physically distancing and masking when you're indoors. And we also, for the summer resocialization document, we stated that we probably are no longer going to classify sport according to the risk of transmission. We're really going to be looking at what's happening at the population level. So what's the degree of risk within that population? Is there a lot of disease that is spreading? And what's the degree of immunity in that population? And that's really how we're going to be guided. But there's still going to be a clear demarcation between vaccinated and unvaccinated. What's not clear, and we were discussing this recently with our last medical advisory group meeting, and Dr. Del Rio is part of that, will we still be testing those that are vaccinated? For example, if they present with symptoms, because even though you're well protected, as Dr. Del Rio said, against hospitalization, serious morbidity, mortality, there's still a chance you can develop COVID-19 when you're fully vaccinated. But the chances are very good that we've essentially neutralized this virus, so it's going to be like a mild flu or a cold. So we're having that debate, and we haven't landed yet, but there will be a demarcation for sure.
The other thing, Brian, that we discussed is that given how quick this variant is spreading and how quickly it spreads, we may get to the end of the summer and it may kind of already burn out, right? It may disappear. So I think part of the good news is it is spreading so quickly that it's going to either infect people or just move on very, very quickly. And now the question is, what's the next variant? What happens next? And we already heard about a new variant called Lambda, which is emerging in Peru. So as long as there's global transmission, we're going to be seeing, new variants emerge globally.
And clearly, Dr. Del Rio, it's crazy how this has shifted. A year ago at this time, the United States was way behind. Obviously, we're leading the world in infections, and now things have flipped. So when we have international students, international athletes that are coming, to our space, obviously there's going to be even more precaution. What's your thought process on, as at least initially, Brian mentioned testing, as you're gathering these populations together when they get onto campus, whether that's July, August, early September, and the same could happen with the student body, at least a baseline of testing, maybe that first, you don't necessarily quarantine or isolation, but just that testing baseline, even if the requirement at that university is that everyone has to be vaccinated to start in the fall?
Well, many schools are requiring students to be vaccinated. And what we are doing, for example, at Emory is we're either requiring students to get vaccinated, or they will then need to be submitted to a testing program of once weekly testing. And a lot of places are doing a similar thing. Now, if you have been vaccinated, we're not routinely testing you unless you develop symptoms. If you become symptomatic, then we are testing you. But otherwise, we don't routinely test you at this point in time.
So, Brian, I'm going to give you a scenario. Let's say we've got a football team in the fall, and, I'm just going to throw this number. Let's say there's 60 players and 40 are fully vaccinated. The other 20, what could life look like for those other 20 on a daily or weekly basis?
Well, the first part of the life, what it would look like is to go all out to try to get those 20 players vaccinated. And, and coming back to that, a lot of the student athletes are saying, well, look, if I get COVID or not, if I'm vaccinated or not, the outcome's the same for me. But when they start seeing in that example that the football players who are fully vaccinated, they have different freedoms that the unvaccinated don't. That is probably what's going to convince people to get vaccinated more than anything else. But just separating that out, part of the testing also is going to depend on what's happening locally. And as Carlos mentioned, and we discussed it recently, if we are at really a low population risk, so the Delta variant has already done what it has done in America, has moved on, so to speak, and there's little transmission, there probably would be surveillance testing, but it may even be at the level of when someone's developing symptoms. So I think it's going to greatly depend on what's happening at the local level. And there's not going to be this sort of general guidance, prescriptive guidance like we had before.
Well, and Dr. Del Rio, clearly at a number of universities where there is a requirement to attend in the fall to be fully vaccinated, and for the most part, maybe faculty and staff as well, it becomes a moot point with the student athlete because they are students. And if every student has to be vaccinated, then they would have as well. How do you handle those that have the exception, whether it's medical or religious, if it's approved, that exception?
Again, it's through testing, right? You're going to have to be testing individuals like that fairly regularly in order to detect if somebody gets infected, because they will then be likely to spread to others. And I think, what we are committed in most campuses is we know we're going to have cases. We want to prevent outbreaks.
Ryan, how do you think that'll play out?
Yeah, I agree. And you know what, there was some disappointment amongst some administrators when we stated, look, we're not going to be classifying sport transmission risk anymore, because we really found that it wasn't in the act of playing sport that the disease was transmitted. It was more day-to-day life. And so it's going to be playing out that the unvaccinated will be tested, and the testing regimen is going to be developed more according to what's happening locally. So if disease risk transmission locally is moderate or high, they'll be on a very regular testing regimen.
Well, the other thing too, Dr. Del Rio, I wonder if, and this happened last year, if you will have some schools maybe be skeptical of potentially playing another school if that other team is not fully vaccinated. And we saw that happen where there might have been a case, and, this happened actually, in the Big Ten, where, one school, this actually happened between Wisconsin and Penn State, where Wisconsin wasn't ready to go to Penn State because Penn State was dealing with a little bit of a mini outbreak. And so they paused, they had to reschedule the game. And those kinds of things can happen around the country, where you could have one fully vaccinated school and team going against another one that is not, and that team may present a little bit of a pause before they participate in that matchup.
Yes, absolutely. That's going to be, that certainly could happen. But my hope is that even though in places that we have low vaccination rates, when you get down to the nitty gritty, there's still, there may still be enough vaccination to prevent outbreaks. So again, my hope is that between people previously infected and people vaccinated, we will see cases, but we won't see huge outbreaks. We have to recognize that, now close to 50% of the country has been vaccinated. And yeah, the good news is that it's 50%. The bad news is that it's 50% not vaccinated. But that decreases significantly the capability of the virus to transmit to others, right? And again, even if the vaccines may not be fully protective, if you have some degree of protection, you're creating barriers against transmission of the virus. So I think the things that we're talking about right now are very different than what we talked about a year ago, because with vaccines and with the uptake we've had in vaccines, while not as great as we would like it to see in most places, there is enough uptake that you're going to have sort of a little bit of a sort of broken, aborted transmission chains happen in multiple places. So we'll see. I mean, my hope is that, again, we don't see huge outbreaks and we won't see tremendous impact on college sports as a result of this variant.
So, Brian, obviously this summer we are seeing full capacity crowds at sporting events. Even actually this weekend, the Euro finals in London, Wembley are supposed to be full. Same with Wimbledon. So we're going to see it as it moves into our college space, but it will be a little jarring if at the big house we got 100,000 fans. What do you anticipate, at least that initial feeling in the college space when we see these massive, congregation of people at Ohio State and Michigan and Alabama, coming for college football games in the fall?
Yeah, we'll see. I mean, we had a smaller example of that. So in Omaha, with the College World Series and full stadiums, and we were in regular contact with the Douglas County Public Health Department, and there was no uptick in regional spread as a result of the College World Series, which was really gratifying. Of course, it's not 100,000 people. It is outdoors, but even the fall football stadiums, they'll be outdoors. So that also I think is helpful. And we'll just see, I mean, this is the great unknown, right? And it's interesting. So like at Wimbledon, you mentioned Wimbledon, they're actually part of a pilot program with the government. So the government is really working with them and tracking how does it really work when you bring together a large group of people in a country that's about 60% vaccinated. So I think we'll get the data and that will guide us as we continue to have large capacity crowds.
Brian, if I can, since I have you, obviously there was a situation with NC State at the College World Series not able to participate in the other spring championships. There were a couple of times, 1, 2, and 3 divisions, where some teams were eliminated earlier in the tournaments because of protocols, and we saw this on the tail end of the winter sports with hockey. Overall, from maybe March to June, how would you assess the way the championships were run through these sort of latter stages of this phase of the pandemic?
Well, I think they were run in an exceptional manner. So, with D1 men's and women's basketball with Lynn Holzman and Danny Gavitt, I mean, they just did a stellar job. And in those 2 championships, there was only one team that had to be disqualified because of spread in the team. And then Joni Comstock overseeing the other 65 championships from the spring and the winter. And out of all of those, there were 9 teams that had to be disqualified because of spread within the team. So when you look at that, it really it's a remarkable profile of safety and things that are well coordinated. And the other thing that was really interesting is that there was no documentation of any spread from one team to another team. So it was always isolated pockets that happened within a team, and then they were picked up, and then that team was disqualified. They went home, and then they observed the proper isolation and quarantine. So all in all, it went well. I mean, we had our bumps and bruises along the way because we were all learning along the way, but everyone followed the same protocols, and the communication, I think, was really outstanding. So look, at the end of the day, we completed 67 championships safely and successfully.
And Dr. Del Rio, one other sort of population within these championships that really had their lives upended, like all of us, were officials. I mean, how do you anticipate, these small little groups, these pods, if you will, in these various sports that were traveling, in this case, had to travel separately throughout the course of the season? How close to normal for their lives do you think we'll see in the fall and into the winter?
Well, again, I think if they're vaccinated, it's going to be pretty normal. I think they're going to have no problem, and they're going to be just fine. If they're not vaccinated, I think they will have some risk, especially when they go into communities that have relatively low vaccination rates. I mean, I'm thinking about, going to Missouri right now may be very different than going and playing in South Carolina. I mean, simply the community transmission is different. The amount of infection in the community is different. And I think that's going to dictate. So as Brian said, I think what we're going to have to do really is, just like you look at the weather report and you say, oh, I probably should take an umbrella because I'm going to travel to X city and it's going to be raining all weekend. I think you're going to have to look at the places like the COVID Act now or many other places that have the local data and say, I'm traveling to a community that there's a lot of COVID transmission. I probably should take my face mask with me. I probably should, not be going out to bars and restaurants because it's probably going to be a high risk activity. While I'm going to another community where there's almost no transmission, well, it's pretty normal to me. So I think we're not going to be able to say absolutes for the entire country. I think it's going to be very local. And I think there's enough resources out there for people to as I said, just like you look at the weather, you make decisions based on that. I think you're going to make a lot of decisions based on local transmission, local how much immunization is in that community, how much viral transmission in that community, which viruses are prevalent, and all that information is now readily available for people to look at.
All right, last two things from both of you. First, from Dr. Del Rio, in my son's high school, as they're breaking down the fiberglass or plexiglass, and then, the signage and all that, I had an interesting conversation with one of the administrators who said basically like, well, we don't want to throw them out because we don't know. So we're going to find some storage. So what's your advice for all these universities across the country that had to basically spend money to outfit their schools for health and safety protocols as they now enter this next phase where we think we're obviously in a much better place, but at the same time can't necessarily dispose of all these things that we may need at some point?
Well, I think we've learned a lot of things during the last year. I think we've learned, obviously, the most effective method is called vaccines. The second most effective is called face masks. The third most effective is called hand washing, hand hygiene. So I think plexiglass barriers are probably not useful. They're nice, barrier to have, but I don't think they're that effective in preventing COVID. I think it's more effective to have two people masked. I would encourage universities and places to continue having hand sanitizer. I think a lot of hand sanitizer is not only good for COVID, but it's good for many other things. But I think we need to really look at how we're using our resources. And again, at the end of the day, I think if you focus on hand sanitizers, masking, and vaccinations, you're going to be fine. So
I think this is a great point. I want you to end with it, Brian, is that my hope is that we are in a better place hygiene-wise going forward. And we've seen this, Brian, this. There's been a lot of transmission of various illnesses within locker rooms because of poor hygiene. And it can be very serious at times, whether it's, whatever kind of bacteria that can fester in that locker room setting. What do you hope will be a positive outcome of this in terms of sustaining proper hygiene in those close contact areas in locker rooms, shower facilities, weight rooms, that we hope will stay going forward to prevent mass flu, IG issues, and so on?
Yeah, I think it comes down to enhanced standard precautions. So what happened with the AIDS epidemic is we moved to what are called universal precautions, and we assume that all blood is potentially infectious and we handle it a certain way, and it's been remarkably effective. So to your point, the enhanced standard precautions, with shared equipment, you wipe it down. With shared tables, you're careful. The wrestlers are very good at this, skin infections, passing that on, how are we really looking at what we are, and if we have an active skin infection or if we have a respiratory infection, we don't show up to work. We don't show up to the athletic contests. And so I think the standard precautions that are, should be in place are going to be much better. And between people not coming to work or coming to athletics when they are feeling a little sick and really making certain that we're taking care of shared equipment a little bit better, I think we'll be in a much better place. And I have a feeling it's going to be here to stay.
And I'll tell you, Dr. Del Rio, in the fall, the next wave of us trying to, hopefully influence people to practice good health protocols is get your flu shot when that comes out in October, November, to keep the flu obviously down now that we've had the vaccine. Look, as always, I learn a lot. I love these conversations because I think they're highly intelligent, of course, with the two of you, educational, informative. And I hope everyone watching really takes this in because we're close and we got to just continue this down to the end and get everyone vaccinated so we can get on the other side of obviously now this Delta variant. Dr. Carlos Del Rio, congratulations on your honor on July 4th. As always, appreciate your time here on our NCAA social series. And of course, Dr. Brian Hainline, the NCAA Chief Medical Officer. All right, so that'll wrap up this episode number 64 in our series. As always, you can go to ncaa.org/social series, where they are all archived. You can check them all out from 1 to 64. We'll talk again next week. Thanks for watching, everyone.